Thank you, David, and congratulations on a fantastic event. Yes, my name is Mahiben Maruthappu. I'm a doctor, but I also advise the Chief Executive of NHS England, focusing on innovation and technology. Innovation. Innovation's something that's transformed human society, connectivity, and longevity. Be it one of our first innovations, fire, to the wheel, to electricity, to now the internet in its various forms. Be it Google, Uber, Airbnb, or dare I say it, Tinder. But what about health? What about health? We've heard this morning about some of the real opportunity in this sector, but also its inherent complexity. And so I just wanted to share the 3x3 prism by which I view innovation in healthcare as the NHS races from the Stone Age to the digital age in just 5 years. And so to do this, it's important to consider where the NHS is, where it's going, and where innovation technology fits into that. So it's important to realise that the NHS has performed remarkably well over the past 15 years. Cancer survival is its highest ever, cardiovascular mortality is down 40%, elective surgical times are down fourfold, and public satisfaction has almost doubled over the past 15 years. But as we know, the system is under pressure, and that's due to an ageing, growing population with more long-term conditions, coupled with more expensive treatments and technologies. And that's caused the emergence of 3 gaps: a health and well-being gap, a care and quality gap, and a finance and efficiency gap. When it comes to health and well-being, we now have more overweight and obese people in this nation than ever before. 1 in 5 children as they start primary school are overweight or obese, and that increases to 1 in 3 as they leave primary school. 17% of this population still smokes, and alcoholism costs the NHS between £3 to £5 billion every year. On the note of care and quality, we still see marked variations in patient experience, outcomes, waiting times across the country. And in terms of finance and efficiency, even with the additional investment from the government, by 2020 we'll have to deliver £22 billion of efficiency savings by the end of the decade. So to try and address those challenges, a year and a half ago we launched the 5-year forward view, our roadmap for how we can try and address these issues. And this entailed a 3-pronged approach: a radical upgrade in prevention, better integration of care, and a focus on efficiency. When it comes to prevention, we have to remember that the H in NHS stands for health, not healthcare. And so we are launching targeted programs, identifying those at risk of long-term conditions that are potentially preventable, and placing them on evidence-based lifestyle modification programs, in several cases that are digitally enabled. And one illustration of that is our NHS Diabetes Prevention Programme, the first diabetes prevention programme in the world that is at scale. And we have almost enrolled 10,000 people onto that programme since it was established. We've also invested over £400 million in improving the health and well-being of NHS staff, all 1.3 million of them. Then, when it comes to better integration of care, we need to, and we are, blurring the boundaries between primary and specialist services, health and social care, mental and physical health, allowing patients and users of the NHS to have a more seamless and better coordinated experience as they navigate the health system. And then in terms of efficiency, we're having a much more robust approach to procurement, contracting, reducing waste and reducing readmissions. It is in efficiency that I feel the role, or the key role, that innovation will have to play in the next few years. And there are 3 opportunities that I really see the NHS having to grapple with in the next few years. The first is genomics and personalised medicine, the second is data and digital, and the third is hardware and wearables. When it comes to genomics and personalised medicine, direct-to-consumer approaches now allow consumers, patients, to sequence their own genomes at a fraction of the cost that it used to cost institutions a few years ago. And when this is matched by new types of gene editing, advancements in biotech, more targeted therapeutics, we're going to see a movement from one size fits all to one size fits many to one size fits one. when it comes to data and digital, we live in an era where knowledge is power. And that knowledge today is big data. Being able to identify who, when, and where is likely to become unwell before they do. Pivoting our health system from being reactive to proactive. Medicine is a field, a discipline that has a number of languages, I would say, from my practice. Genomics, pharmacology, anatomy, but the language that's perhaps going to be most impactful over the next few years is code. Digital will disrupt, democratize, decentralize healthcare like no other innovation before it. And that's why it's key that the NHS can really grapple this head on. It can slice through administrative costs, and it can provide patients, users, citizens with a completely different dialogue with the health system. And then hardware and wearables. So smartwatches, portable and wearable ECGs, ophthalmoscopes that attach onto your phones. Each of these permit us to provide better interconnected care, merging monitoring, diagnosis, management, and treatment all into one, and allowing the patient to be at the center of that, allowing a person to be in the driving seat of their own care as opposed to their clinician or their therapist. And when that's matched with a completely disruptive form of manufacturing like 3D printing, we're going to see patients being prescribed medical devices via the net and then being able to print what they need, when and where they need it, on demand. And this is probably perhaps a few years further down the line, but 3D printing perhaps will be even more interesting when we start blending that or intersecting it with regenerative medicine, printing perhaps organs or tissues as opposed to just devices. But the key question this all raises is, how do we make it happen? How do we allow the population in England or elsewhere to actually use some of these technologies as opposed to keeping them on the shelf? And so that's why I think we need to have a real focus on innovation technology in the NHS, and I view this through three lenses. There are three priorities that we have in this space. The first is on organizational change, the second is on combining innovations, and the third is on scale. When it comes to organizational change, we need to give frontline staff, clinicians, the headspace and the breathing space they need to adopt and deploy new technologies, to explore new ways of working. And that's why we've launched 50 vanguards across the country. These are locations covering around 12 million people in total, backed by hundreds of millions of pounds of funding, where we are exploring new ways of working that are clinically driven, giving these people, these NHS staff, the ability to change the shape of the system that they're working in. Importantly, though, we're exploring new ways of working and partnering with tech companies, with industry, and that focuses on value as opposed to just volume. So let's say you have a smartwatch which can improve diabetes outcomes, or you have a machine learning algorithm which you think would be helpful in triage between A&E, GP services, 111, 999. We will give you the opportunity to put your money where your mouth is. We'll allow you, should you deliver certain outcomes, to be reimbursed upon those outcomes. And I think that pivot in healthcare technology from just volume, from just moving stock off the shelf to value is going to be quite instrumental in the coming years, especially given the pressures that all of these health systems are under. The second priority is combining innovations. I mentioned three categories of opportunity that are going to transform healthcare over the next 5 to 7 years, but the real change is going to be when we can combine innovations from each of these categories. So let's say a new monitoring device coupled with a patient's smartphone, with a new video consultation platform, with a nursing workforce model, and a new cardiology-led community clinic. It's that combination that will provide the most value both to the patient, but also to the provider of care. And it's that combination which is going to yield the greatest value from these innovations, as opposed to using each of them in isolation. And so to try and address this, we've launched a handful of test beds across the country, covering a population of around 1 million people each, where we are investing in NHS infrastructure to make it more liquid, to make it more agile, so that it can complement some of these new technologies that are being rolled out. And the types of questions that we perhaps will be exploring in the next few years are, well, with the advent of, let's say, self-driving cars, with companies providing new GPS services, how can we use that? How can we partner that with the NHS to identify road traffic accidents or to reduce them? and to respond in a better manner with our ambulance services. So that's combining innovations. The third priority is scale. The NHS has 1 million patient contacts every single day, and yet we have pockets of excellence around the country as opposed to uniform, equitable quality improvement. The saying goes that the NHS has more pilots than British Airways, and with the greatest respect to BA, that's something that we probably need to change. And so to try and address this issue of scale, we launched an accelerator 9 months ago with 17 innovators and their respective innovations, with the specific focus of working with them to identify some of their barriers to spread and scale. And although it's been a relatively short period of time, they've made some incredible progress. Their innovations have benefited over 3 million people in the past 9 months. They've secured over 40 contracts across the country, and they're now in over 60 NHS organisations, all in less than a year. And that's just the first year. Innovation, I think, is going to take healthcare from incremental to exponential. It's what, in the NHS, can straddle fantasy between politico-economic reality. But there isn't a magic bullet to making it happen. We're going to have to stack system levers, incentives in favour of innovators and innovations by working with them, working with entrepreneurs, with tech companies, but also clinicians who are responsible for delivering this on the front line, to try and create an open platform NHS that's open for business. Thank you.
So Ben, I'm sure everybody here loves the idea of the agile, innovation-led NHS, but there's quite a lot of people here from startups that call themselves disruptors, that see themselves up against the incumbent. And I don't think you can get more incumbent than an organisation with 1.3 million salaries to pay. And there is evidence that even minor reforms, such as changing the hours on a Sunday that a junior doctor works, can lead to explosive consequences. So without damping your idealism, do you not see some huge internal bureaucracies, some internal barriers of mindset to changing the way things are done?
Yes. So to answer your question briefly, well, I mean, we've reached a point where we can't afford to turn off innovators. They're going to other countries, and if that's the case, the NHS risks becoming a second-rate health system, which I don't think anyone wants. So that's why we are making this focus on innovation technology, and we're trying to provide different routes, different means by which people can try and navigate the system to make it easy. I mean, no question, it is complex, it can be challenging to navigate, and those are some of the issues why yesterday when I was in A&E, I was still using a fax machine and a pager and a bleep. But those are things that I think almost everyone has come to the conclusion we have to change, and that's why we're really trying to invest not only time, effort, but also money in trying to alter that culture and make it more disruptable for startups.
We don't yet have an effective digital medical record that all of us can check on our smart devices that ensure that there are no mistakes made between clinicians. How long is that basic step going to take to be implemented?
So by the end of the decade, so by 2020, we want and are hoping that everyone will have electronic medical records that they themselves can access. I mean, already 99% of people can access their summary medical records online, in addition to doing e-prescribing and several other things digitally. But that is a significant step. One of the reasons it's taking so long is because there are so many notes, frankly, that have been handwritten. And trying to convert that into a completely digital framework for a system that is so large, somewhat fragmented, is challenging.
Last question. You must see a lot of very exciting startups doing things that you think, wow, we have to embed this in the National Health Service. Give us an example of something you've seen lately that's made you get particularly excited.
So I think, in our accelerator, for example, not to shamelessly advertise it, we have plenty of great innovations and respective companies. So one that I really like the look of is called Nerve Centre. It digitalises all patient observations and vital signs in a hospital, but also the tasks that doctors need to be doing and nurses, in addition to other members of the multidisciplinary team. And They're now in over 30 NHS trusts, but have critically halved out-of-hours hospital mortality, which I think is a significant number for something that is providing a platform on which other people can work on, as opposed to being a blockbuster drug or a new type of surgery.
So stick around, Ben, because I may have mentioned there's £100 billion to spend, and I'm sure there's people who are going to want to give you their business card. Thank you very much.
Thank you.